All right, today I am going to be doing the wound care sign-off. So I'm going to start with my 12 safety practices, which will be verify the patient's orders. I will perform hand hygiene before and after providing any care for the patient. I would verify the facility's policies and procedures and gather up all of my supplies. I'm going to check the manufacturer's recommendations for any of the supplies and equipment I'll be using. Going to knock on the patient's door. I identify the patient by 2 identifiers. I'm going to note the overall condition of the patient. I will explain the procedure to the patient and provide for privacy. I'll raise the bed for good body mechanics and don PP if necessary. When I'm done with the procedure, I'll lower the bed and provide the patient with their call light, and I would report any abnormal findings to the charge nurse immediately. So now what I'm going to do is I've got my wound here, so I'm going to put on some gloves and undress the wound and measure and clean the wound. So I am going to remove the dressing from the wound away from the patient. I'm going to ball that up in my glove, take my gloves off, and put them in the trash. Now what I'm going to do is put on another set of clean gloves so that I can clean the wound. So I'm going to take a gauze. Also what I would do is I'm going to note the condition of the wound, any redness, any type of swelling, any type of drainage that I see, I would note. I would also note how many gauze I took out that were previously packed in. I would note that when I would do my charting later. So what I'm going to do is take the gauze and I'm just going to do a swipe down to clean it, and then I would dispose of that, and I will get another gauze and swipe down to make sure that the wound is indeed clean. Next, I'm going to measure the wound. Looks like 7 centimeters in length and 3 centimeters in width. Next, I'm going to check the depth and look for any undermining, any tunneling in the wound. I would not do that to the patient. So I'm just going to go around and feel for the deepest spot of the wound, and I will see where that comes out, and it looks like 1/2 centimeter. So I'm going to set that down. I'm going to remove my gloves, and then I'm going to prepare my tape. So make sure I think 3 should be enough for this wound. It's not that large. Then what I'll do is I'm going to write down my initials, the time and the date that I changed the wound. That way the next person will know what time the wound was changed. So got my saline here. So, and now I'm going to begin the sterile portion of this. I'm going to remove this away from myself. Careful not to go inside of the 1-inch border that we have here. Now what I'm going to do is get my gauze. I'm going to open it away from myself and pour it onto my sterile field. Careful not to reach over or into my sterile field. Now, since the inside of this is sterile, I'm going to pour in the saline. I'm going to take the saline with the label in my palm, make sure that it's not expired and that it's still in date. So I'm going to pour the saline in here and set that down. And now I'm going to set this down, and I'm going to sterile glove, making sure that I'm not touching inside of the borders here. So I'm going to pinch this glove and place it on. Then I'm going to slide my fingers under here, thumb first, slide my hand in, and now I am in my sterile field. I'm not going to drop my hands below my waist or lift them above my shoulders. And I'm going to come over here and get the gauze. I'm going to dip them into the saline solution and dry, kind of puff it out or fluff it, I guess, into my hand. That way I can easily pack the wound. I want to make sure that it's not too wet. Then I'm going to come over to the wound and I want to pack it not too tight, not too deep. I don't want to get, I don't want to injure the wound anymore, and I also don't want to pack it too tight so that it and have it so wet to where there's a lot of extra liquid inside of the wound. So I would pack that down, and then what I would do, just assume that that's packed in there, inside of there. So I would pack the wound, and then I am done with my sterile field. So I can take my gloves off, and I can, what I'm actually gonna do, since I'm still sterile gloved, I'm gonna put a gauze over. I'm also gonna note how many gauze it took me to pack the wound. I would put a gauze over it, and then I'm gonna take my pad here, and I'm going to place it over the wound. Then I'm going to place my tape over, which I've already initialed and signed off on so that the next person knows. And I am done with the patient. I would clean all of this stuff, remove my gloves, perform hand hygiene, and I would also note, I would ask the patient if they're in any pain, or like how the wound feels from the last time it was cleaned, if they felt any pain or noticed any differences. I'll note any drainage, any redness, and that's it. Thank you.